thank you for the opportunity to be with you again for today's hearing. I am Zach Shamberg, and I am the president and CEO of the Pennsylvania Healthcare Association, better known to most as PHCA. We're a statewide advocacy organization representing both nonprofit and for-profit long-term care facilities. That includes nursing homes, personal care homes, and assisted living communities, as well as, and most importantly, their frontline workers and the residents that they serve. This is not my first time speaking to your committees since this pandemic began. And today, rather than focus on the illness that is COVID-19, we have the opportunity to finally talk about the remedy. But what's so disheartening about that, as the committee members have shared already, and as your constituents have likely shared with you, is what happens when that remedy doesn't come quickly enough. When the COVID-19 vaccine was first approved for emergency use, it was cause for celebration for those who we represent in long-term care. And in early December, when the CDC voted to recommend that long-term care residents and staff receive first priority for the vaccine, we were very hopeful that our Pennsylvania officials would follow that suggestion. On Monday, December 14th, the first vaccine arrived in Pennsylvania. And as Chairwoman Ward noted, not a single long-term care resident or worker received it. So one day went by, and then 1 week, and then 2 weeks. Not one long-term care resident or staff member received a dose of the COVID-19 vaccine until Monday, December 28th, a full 2 weeks after Pennsylvania's hospitals received their doses, and the same day that the state of New Jersey, which missed a federal filing deadline, began to vaccinate its facilities, and the same day that West Virginia completed its first round of vaccinations for every long-term care resident and staff member. So I'm compelled to ask why. Why would long-term care be forced to wait for an antidote to a virus that has quite literally killed thousands? And based on the latest data that we have, contrary to what you've heard already today, Pennsylvania is weeks away from every nursing home receiving a second dose of the vaccine. And now we are months away from every personal care home and every assisted living community receiving their second dose. Again, I am compelled to ask the same question that many of you asked at the beginning of this hearing. Why? We can look back, but this Commonwealth and our leadership must look forward, because the providers that we represent remain deeply concerned about the unknowns that lie ahead. And today, I'd also like to offer you solutions. First, when will the allocation of the vaccine truly be prioritized and increased in long-term care? Senator Yudichak noted this earlier. Less than 20% of the available vaccine has been allocated to long-term care thus far. Is that prioritization? We need an increased ongoing allocation to CVS, to Walgreens, and any pharmacy partner willing to vaccinate our most vulnerable, because 20% just doesn't cut it. Second, after the federal pharmacy partnership ends, what is Pennsylvania's plan to continue vaccinating long-term care residents and staff, including our new hires, as well as new patients? Chairwoman Collette pointed this out, as did Ms. Owens. We need guidance from the state on this issue. It can't be every provider for themselves. So let's come together and fund the continued partnership of long-term care and local pharmacy partners who are willing to continue vaccinating at our facilities. Third, what does reopening and visitation look like in long-term care after the vaccine? Again, Chairwoman Ward was exactly right. And I'm sure that every member of this committee is receiving calls from constituents on this issue. Our providers want to help facilitate visits again. They want to return to normalcy, but they must also have clear post-vaccination guidance from DOH and DHS. Now, you heard earlier today that we're waiting for CMS and the CDC and the federal government, but try telling that to a family member like Chairwoman Ward, or a family member like me, that we're waiting for Washington, D.C. to tell us when we can see our loved ones again. For the second most regulated industry in the entire country, it is not as simple as just reopening our doors. We need clear direction from the state so that providers can reunite family members with their loved ones. And finally, and you might be surprised to hear this from a long-term care advocate, we need a plan for mass vaccination in this state, sites, clinics, and distributors. I've told members before, independent research clearly indicates that community spread of COVID-19 equals a greater likelihood of spread in our long-term care facilities. We decrease the number of cases in the community, we increase the likelihood of a better, safer tomorrow for our residents and staff in long-term care. So let me close by saying this. Last spring, we called for prioritization and collaboration for long-term care in Pennsylvania. Today is no different.